Thanks for participating in the consultation. So today's agenda is basically we will review the scoping paper. The scoping paper is a part of the consultation we started for this program. Partly under this, we have a conversation with stakeholders who are currently based in Bihar, working on Bihar, and also we mapped out existing peer-reviewed articles, and based on that we come up with learnings where we can commission studies in future. So today's program is like that. So I will ask Dr. Gupta, Member Secretary Adri, to give a welcome address for this program.
Friends, this is a very informal meeting, and we are essentially relaunching IGC in the context of Bihar. You know, IGC has been functioning for a long time, from 2009, but somehow because of some unavoidable reasons, it had to be discontinued. Now IGC is going to function mainly in Bihar. It was earlier a pan-Indian agenda, but in one way it is very good. It is a state-specific agenda, and here we are mainly going to take evidence-based research, which is very essential for framing policy. In some sense, we have been involved with the policy making for the last 25 years. In the process of evidence-based research, we have been doing economic survey, we have been preparing many documents related to public finance. We have been working on other social science agenda, because now, because of criticality of development and because things have become much more complicated, it is difficult for government to use or make policies based on their in-house research capability. So they would like that some outside help is needed. Now Bihar is not that bad. It is not like any of the African countries where there is no basis of research in the different department. But nevertheless, in Bihar context, I can say, as far as the finance department is concerned, say 10-15 years ago, practically there was no documentations. So we were first to start the economic survey. Then, for example, even memorandum which was to be presented to the Finance Commission, it was also not very well documented. But we have been working on this thing for a long time now. What IGC is expected to do here in Bihar, that to involve the stakeholder who could possibly give help in preparing evidence-based policy making. We have already brought out one scoping paper. Now Kumar Das and Manish has been working on this for a long time, and they have been able to identify the research gap in Bihar. So this meeting is a very informal one, where this research gap, if it is still left, can be discussed and it can be incorporated in this document. And my submission will be that we do more interaction with the government, because essentially what IGC is worked out its agenda in such a way that we need to get demand-driven research project. So you have to have a close interaction with the government, and in the process we can generate demand as far as research gaps are concerned, and possibly we can, on the basis of that, if the project is submitted, that will be evaluated at our end, and IGC will be able to support that thing, support that research agenda. I think you know very well that things are getting much more complicated. We have already seen 2 industrial revolutions. first and the second industrial revolution. We are undergoing through the third industrial revolution. Shortly we will have a fourth industrial revolution, which will be mainly based on artificial intelligence. The world is changing very fast. On the basis of that, government and other organizations will have to keep its track on the basis of that. So all the organizations which are based in Bihar, they will have to function in such a way that they can act as a catalytic agent in providing research support to these two policy guidelines. So what we have to do that we will have to provide research support to different departments, and normally what happens that we plan for something at the end of any project. Here we will be doing a sort of a conjoint activity with the department, so that any policy which is made that has long-term repercussions, and even at the stage of formulation we can do the research also. So it is quite a interesting and challenging thing, and we have to keep this thing into our mind in a very concerted way. IGC, I think today's main agenda will be a consultation about this scoping paper. If there is any gap, I think it has been done in a very meticulous manner, and if there is any gap, possibly we can fill that gap. And Neeraj will be here to help us in strengthening the research gap of the institutions which are located in Bihar, and they will be given some idea how to strengthen themselves, so that the local organizations are strengthened to keep state-of-the-art research capabilities in the context of Bihar. I would not like to speak anything more. If anything is left, I think Kumar will be able to
That's fine. Thank you.
fill the gap.
Thank you, Dr. Gupta, for giving the welcome remarks. So before we start the presentation, we just thought to give a brief overview over the program. So the IGC in partnership with BMGF is currently preparing to engage with government, research organizations and academics who are currently based out of Bihar, and take a look on things on the priority sectors. For us, the priority sector was previously health, agriculture, financial inclusion, and based on that, we also considered, because agriculture, environment, everything is interlinked, so you can't work on silos, working on health or agriculture. So now the decision is basically we will take a look on everything for commissioning research, and then we will prioritize. So the scoping paper is basically give you an overview over health, agriculture, climate change, and bit of financial inclusion, and gender is another part of it. And then we thought, okay, rather than prioritizing things, it's better to have a conversation with all the stakeholders who currently work in Bihar, so they can suggest, okay, where they need more research, so then we can come up with a call for proposals. And the program started with a consultative process, as stated earlier also. In one hand, we had conversation with stakeholders who are currently working in Bihar or in Delhi, but they have interest in Bihar. And in another hand, we mapped out the peer-reviewed articles and existing evidence, and based on that, we come up with the priorities. Those priorities are basically not IGC's priority, but this give a sense where we can commission studies. There are times what policymakers want and what research identifies, so there is an enormous gap into that. And when I take a look on Bihar, we figure it out that there are evidence which are available in India, but those are not applicable to Bihar context, because maximum times those peer-reviewed articles or evidences didn't incorporate a context and factors. So like if I give an example, like maximum art cities talk over the trials, but they didn't incorporate the context while analyzing or take a look on the outcome part of it. So the rationality of the scoping paper is, before commissioning the research studies and for the call for proposal, we thought it's better to come up with a paper which will guide us for commissioning studies and take a look particularly on evidences in Bihar on the priority sectors like health, agriculture, financial inclusion, and also gender is a part of it, because every article stated gender, and for them gender is basically incorporating women in the dialogue, but actually it's not, because maximum articles didn't take a look on the gender analytical frameworks into that. So what we thought, okay, why don't they incorporate those things and how we can go further on that. So the process we followed, basically, I already clarified. Okay, we started having conversation with stakeholders, and at the same point of time, we mapped out the articles. So for us, we only take a look from 2000 to 2018 March on till February 2018 March, and based on these 2000 to 2018, we only consider the peer-reviewed articles, not the NGO literature or the grey literature or any evidence or any impact evaluation studies which are not on Bihar. We only considered the peer-reviewed articles because we realized, okay, these are rigorous studies, and for maintaining the rigorousness, we considered those on, and because there are times when NGOs and even agencies and government have a lot of reports, but we don't know, okay, how they conduct those studies and what are the methodology they followed, how rigorous those are. So for this, we did only that. So that gives you a brief summary. So for the stakeholder conversations, we already had conversation with 37 different organizations who are located in Delhi or in Bihar. And out of that 37, 65 are the respondent. So in the presentation, we give you the details over the respondent, who are those and what they stated. And the second thing is reviewed articles, only the peer reviewed. We only take a look on 224 on the 224 on the priority sectors. These priority sectors are only on health, agriculture, and financial inclusion, and part of gender on that. And for impact evaluation studies and systematic reviews, we only consider those studies which are available on net. And for this, we take a look on EPPI database of UCL and Cochrane Foundation dataset. And for impact evaluation studies, it's basically 3IE Riddle 1. So based on that, first I will give you a detail over the evidence gap map based on the impact evaluation studies and also peer-reviewed articles. So what we did, we identify the topic areas while reviewing the articles. So like you will figure it out in the scoping paper also. In the health sector, the topic area is suppose public work program, the home visit or the facility visit or mHealth, and the mass media, health finance. These are the topic area which gives us information on what the study conducted, and based on that we also identify those topics, how they incorporate different initiatives. Like suppose this is a home visit, that home visit is related to knowledge and attitude level changes, or is it related to care practices or behavior or quality of care? And under everything we also incorporate, suppose a knowledge and attitude, we take a look on individual and household level service provider, and also if those intervention address any norms, changes in the social norms in the community on RMNCH+, like that way. So we mapped everything on that basis. And based on that, we mapped those peer-reviewed articles. If suppose Malviya on his article on home visit, what are the things he addressed on that particular thing? And based on that, if we realized, suppose if there is any problem on that, so what are those gaps? So we will talk over the gaps in these evidences in later on. So like that, we also did the agriculture part on that. Suppose paper on access to credit, and what are the things they stated on that? Is it on gender and agriculture, or having an access to credit? Is it related to having better access to input or better access to information? Like that way we divided everything. So in the scoping paper we give all the details, and then we come up with the stakeholder consultation part. So for the stakeholder consultation, we had conversation with research and research agencies, event bodies, NGOs and CBOs and INGOs, and also with the government stakeholders. So based on the chart, we had conversation with 36%, means 36% respondents are from the government or departments, while the 43% are from NGOs and INGOs who are currently working on Bihar, and even agencies is 6%. So like that way we mapped out everything. So while having a conversation with them, because as stated earlier, our program is take a look on how we can use evidence in a better way, or how we can influence the policy with using the existing available evidence. We figured it out, okay, maximum time when we had a conversation with NGOs, INGOs and the government, they stated like 59% stated they only rely on M&E data. While we ask them okay, if there are any impact evaluation studies available on that particular thing and also on Bihar, did you use those? So only 27% said okay, sometimes they use, but maximum times they depend on their regular monitoring and evaluation information. So then we ask, okay, why don't you use? So there are responses like, okay, sometimes they don't know there are evidence availability, and also even if the evidence available, they don't know how to use that. So, and also then when we had a conversation, okay, and what are the things you used, like type of evidence for your current program? So like 15% said okay, they used anecdotal evidence, or observational studies, whatever they conducted in-house, they only rely on that. So we realized okay, there are, like all the agencies are working in Bihar, but there are times because of this lack of initiative on the knowledge sharing part and also using of evidence on the program, people are not using that. So this chart will give you details over, okay, because when we have a conversation with the stakeholders, we also ask, okay, what are the things you feel like you need more evidence, where you can commission more studies. So then they stated like 30% stated they need more studies on access to credit, but those access to credit information are mainly related with agriculture and financial inclusion part. And while we have a conversation with health organizations or agencies who are currently working on health, so then they stated suppose about they need access to health care 54%, and like that way we mapped out everything. So when we had a conversation, because we realized that there are no evidence available on health insurance part, and on that health insurance part, okay, when we had a conversation about the private sector involvement in health, so then we realized okay, there is a demand, but there is no available evidence. Based on this evidence needed, and also our peer-reviewed articles, in the book we also come up with the gaps in the existing evidence. For as an example, I use the adolescent part. Like we know in Bihar, Sabla is working. Now government come up with Kanna Uttan Yojana. But we don't know how these community level platforms are disseminating information on SRHR. There is no evidence available. And when we take a look on also on Pop Council data on the Udaya 1, that Udaya 1 also not able to give us information, okay, the number of participants, the number of respondents who are part of community-based platforms, is it Sabla or is it SHG? And maximum time we realized, but when we take a look on these studies and also on the Udaya data, so if you are married, only you are part of that platform. So adolescents who are not married, but there is a need of SRHR information, they are not part of that system. So like that way, and when we take a look on these impact evaluation studies, we realized not a single study is able to give us information over how these community platforms are helping or disseminating information on SRHR, on abortion or sexual reproductive or on menstrual knowledge. So we had a conversation long back with the Principal Secretary Health, and on that point of time he stated that he is more interested on the menstrual hygiene part. But when we take a look on these peer-reviewed journals, we are not able to figure it out. So we put the details in the gap in evidence in the scoping. So that's just an example. Even if I use another example of child marriage, on the child marriage part also, there are studies which address norms related part on, there are studies which give us a details, okay, if you have a education or social welfare scheme which gives girls account conditional cash transfer, but those studies also are not able to give us details, okay, because of those particular attendance in the school or getting benefits from the social protection schemes, there is a decrease in the child marriage or not, because those studies are not able to address the social norms on that particular thing. So we realize addressing the social norms and also this economic part of child marriage never addressed in the any available impact evaluation studies and also on systematic reviews. So if I give you an example of agriculture, on agriculture we realized there are studies available on access to inputs or using technology for better knowledge in agriculture practices. But those studies are not able to give us information having better knowledge or information does create any changes in the practice level behavior. So those studies give us information before intervention these are the things and what exactly happened after the intervention. But when you take a look on these factors and also on the actor side, those studies are not able to give us those details. As I stated earlier also, maximum RCT and impact evaluation studies which we reviewed through this 3i Riddle database and also from EPPI, we are not able to get information on context and also on factors. Like they narrowly, those RCTs narrow it down in a way, okay, you need to just do this, do this intervention, and because of that there is a changes, but they never stated what are the factors acted for these changes. So these are the things. And then what happened after having the discussion with stakeholders and also with the peer-reviewed articles, we realized that these are the emerging research areas. So these are not IGC priority areas. So what we stated previously also, we clubbed everything. We don't state these are IGC priority. So these are basically emerging research areas where we realize the stakeholders need more evidence, and also at the same point of time in the peer-reviewed articles also there is no evidence available. So like if I give an example on health, nutrition and sanitation, so there are cash transfer studies available, but on those cash transfer studies they never incorporate how these cash transfer studies addressed adolescent sexual reproductive health issues. Or there are, because maximum cash transfer studies address the maternal and child health, but they didn't address any adolescent health related issues. Or as mentioned earlier also, the community platforms and participation. We don't know what exactly happened with these community platforms and the participation of these adolescent girls in the SRHI program. And also like that way we put things like our migration also, when we take a look on migration, we know Bihar have a huge tendency of migration from interstate and also intrastate. But when we take a look on the migration angle part in research, we realized there is no study available on what exactly, on the state effectiveness, what exactly happened on because of migration, if people have better access to service delivery or not. Like children who live with parents in the village and children who shifted from Bihar to other state, is there any differences on health because of this migration and also the state effectiveness? Because Kerala started to giving the social protection policies to this migrant community, and Maharashtra also started giving that part. But we don't have those information available to influence the policy in a better way. And like we also don't know what the private sector in Bihar or when private sector in Bihar and the role of private sector in health insurance and also on health facilities. And when you, I just give you another example over the nutrition part. When you take a look on nutrition, everyone is talking over the IYCF and also over the also other thing, but we are not able to figure it out. Studies related with the stunting, and also on the nutrition governance. Nutrition governance, in essence, who are the stakeholders, how the stakeholders behave, and what are the power relations among them, because but everyone is working on the nutrition sector. So like that way, we put down the details. And then on adolescent, I already mentioned, okay, over the life skill programs, the government of Bihar invested a huge amount of money, but we don't know, okay, what exactly happened with this life skill program. And also in agriculture, okay, over the cost effectiveness, there is no availability of cost effectiveness studies on agriculture and the role of technology. And also we don't know about the rural credit linkage. Over gender, maximum studies stated things over gender, but what they missed on that, they never use gender analytical framework on that. Okay, only addressing women and using the particular framework on particular intervention is a different thing, but maximum studies didn't able to address that. So these are the basically part of this scoping paper. So I also would like to give an example, information over our local capacity building part. That local capacity building part is basically give information over what we will do for in Bihar, and also our previous work on IGC ISI summer school. So like previously, IGC and Indian Statistical Institute in Delhi used to organize organize summer school for PhD researchers and also academicians. We will also organize the same like previous year in Delhi. But what is new in this time, we will organize a partner winter school. So for the partner winter school, what exactly we realized, okay, when we started having conversation with the stakeholders over the data and also what kind of evidence you use, we realized maximum time they only rely on their M&E data set. And, but they never used other evidence and other things. So the partner winter school will give training to these local local researchers and mid-level junior bureaucrats on how to use data in a better way to address the program. Because using data is different, but what will lacks maximum time. So for this, we thought we will organize the same like what we did previously in Delhi, in Patna, and we called the Patna Winter School. And for this Patna Winter School, we will start with doing a TNA, training need assessment, and we already had conversation with EPOD of Harvard. So they will helping us to do the TNA, and on the basis of the TNA, we will come up with our own strategy, okay, whom to target basically. Is it only the development practitioners or the researchers or the mid-level or the junior bureaucrats who? And if we want to combine the courses for them, how to do that? Because there are times when the researchers need different skill sets while the bureaucrats need different skill set. So we are strategizing with EPOD, okay, how we can club things together in a better way. And also we will organize one partner data workshop. So that data workshop is basically, okay, the researcher stated that there is a gap in the data set. And then we will ask the bureaucrats or the relevant department stakeholders to come together and have conversation, okay, how we can proceed further. And the researcher will tell us, the bureaucrats or the senior bureaucrat or the department, where the data gaps and how to fill that. And even if the data is already available, but those analysis is not available in domain, open domain, so how to do the work on that and how to proceed further. So the partner data workshop is basically, we thought now, okay, give a researcher and the bureaucrats give a space where they can have conversation. So now the floor is open because we sent the scoping paper long back, and we thought, okay, because we missed things. Like I stated, okay, there are times when you're reviewing the peer-reviewed articles and don't incorporate NGO, INGO studies, and also studies which are ongoing, but not in public domain, it's not possible for us to review those. So now the floor is open for 45 minutes before the lunch, so we can discuss more over where we can commission studies, because the scoping paper is very limited on few things. The scoping is limited only on health, nutrition, sanitation, and agriculture financial inclusion. But we also take a look on environment, climate change, but there are times when we are not able to address all the issues. So as stated earlier also, the objective of this stakeholder consultation is, if you want to add something, or if the researchers or the development organization were currently working on Bihar, they need particular things or they need particular research, so then we can commission studies on that, because we will come up with our own call for proposal. As by June onwards, we will come up with a call for proposal. So if you want to add something, or if you want to tell us what are the things we didn't incorporate in the scoping paper, so because it's a draft scoping paper, I already stated, so we need to finalize the scoping which will help us for our call for proposal. So that will help in one hand, and also in another hand, I would like to give you information over the grant system we have currently. Currently we have one small project facility, and also we have larger grant. The larger grant is basically, we used to come with call for proposals twice in a year. The first call will be on June or July 1st. So we will also circulate the call for proposal on that. But we have a small project facility. That small project facility will give the researchers and the policymakers or the development organization, suppose you already rolled out a survey and you want to evaluate particular scheme, or or suppose you already do a matchmaking, suppose the government stated, okay, we want to evaluate some of the component and they need an early response. And we don't opt for, on that point of time, we don't opt for the call for proposals. So on that point of time, for this small project facility, you just need to apply to us. So, or you just need to state it, well, we want to evaluate that program, do you have any researchers for that? So then we will make a connection to the research, because IGC have a networks of 5,000 researchers. So we will connect with a suitable one who did already the same work in Bihar, or who have the same interest. And then we can commission the studies for the government, or if the researchers want to do their own studies, so we can commission the studies for them. So these are the small project facility. And also we will come up with a one rapid response thing. The rapid response is basically, the small project facility is basically a 1-year program. Within a year you need to give information over how things are working, and the larger grant is basically a 3 years, but the rapid response is, suppose there is existing data set, there is availability of existing data set, or suppose you already completed 2 rounds of data, you already completed 2 rounds of survey, but you don't have enough time to take a look on things, how you can proceed further, because then we can commission, you can give a grant for the rapid response. And this rapid response is basically a 3 months thing. But on that, you really need to incorporate government in the dialogue. Suppose the government want, or suppose you already did, like Udaya already did a survey in the Udaya round 1 survey, and now they want to take a look how this adolescent performs working. So then we started having conversation how we can collaborate further on that particular thing. So like that way, I'm just giving an example, and now the floor is open. If you want to add something, that's fine.
Yeah, sorry. This is Samir here. I work with Araka Foundation. It's a quite interesting presentation, and it's a really nice scoping paper. But I was wondering, why did you not include education? Because this is the area where there's no evidence. Everyone is looking for an evidence in education. Even in the government officials, they need evidence, but you didn't include.
Yeah, I already mentioned, we're sorry for that, because when we started the program, we thought we will only consider agriculture, health, nutrition, and financial inclusion. And on that point of time, we didn't incorporate education and other things. So if you have particular thing in mind, you want to evaluate the program, so then we can add before finalizing the scoping. So if you, as you mentioned, education is one of the parts, so we can add education, but which part of education you want to take a evaluate? Basically, is it a ICDS program, or is it a midday meal scheme, or is it a school attendance? So like that way, because IGC already have few studies on education. So if you can add things, so then we will, in the call for proposal, we will put education as also one of the areas for the research.
No, actually, this is like it's only our learning outcome we have been talking, and the rest of the things may have some evidence. But you know, as we all are aware, that Niti Aayog also has been asking for learning outcomes nowadays. So basically, learning outcomes of elementary education.
Okay.
It's not any particular project. I think it's general elementary education.
I had a few thoughts, and please let me know if any of them are no longer pertinent, since so first being about just looking at research studies. Can everyone hear me all right?
Yeah, that's fine.
Just focusing on research studies on Bihar, I think that narrows down the sample of research studies available. I'm sure you have emphasized a lot on context, and Bihar is not outside this world, right? It's part, there are contextual factors that are similar in certain settings, in certain cases, to certain other places, and I think increasing that pool will improve the quality of research available, because otherwise there's no point in doing research, right? If we just focus on where it was done without wider implications, then there's no cost benefit of doing research if we just focus on the place where it was done.
Okay.
So that's one thing to consider. The other thing to consider is when you this maps that were shown, I think they're great. Campbell collaboration has these evidence maps and portals, and since you have worked with Cochrane
Foundation, yeah.
What they do is to organize this availability of data or research studies around a theory of change. So they have a theory of change mapping and place, like give colors on where is that the quality of evidence is, where is that evidence is available, what's the quality of that evidence, and what's the cost considerations of that evidence. So I think just changing that visual representation, which is great, but just along the dimensions of a theory of change, so that policymakers can pick relevant things. That's second. Third is, I would just suggest if you could dig deeper into why organizations do not use research studies as much as they do M&E. It could be it's because they do not know evidence is available. It could be because they don't have the skills, but it could also be that they didn't have the opportunities. So for example, if I'm running a program on education, if I've started the program, I do not want to look at other evidence on whether such a program, once I've started. Before I started, I might. Once I've started, it's not in my best interest to look at that evidence on, or which would lead me to probably shut down that program, right? So I might as well just give it another go. So looking at the opportunities and incentives available towards understanding why research evidence usage is low. It may not just necessarily be a skills factor or a supply related factor. Finally, there's a tremendous role of descriptive data in identifying policy issues. And for example, in nutrition, I'm sure you're aware that IFPRI has published this district nutrition profiles. Even if organizations, through your effort, through all the work you have done, are aware that these things exist. So I think when it comes to thinking what to do, descriptive evidence has as much as a role to play, and it's cheaper also, in deciding what are the problem areas, what could be the potential factors, and it's not necessarily always going to be impact evaluations, which are going to be limited. So if I have to start something in Nalanda, I need to understand what the situation in Nalanda is. And there's even enough evidence available out there on what that situation is. So to include, just considering including descriptive evidence and the quality of that evidence is very important. I think portion report cards are high quality. They have looked at NFHS. So looking into the quality aspect as to what data is reliable, what is not, I would encourage you to think through about whether you could increase the scope of using descriptive evidence, whether it's portion or whether whether it's us or on learning outcomes. Finally, I think this is a huge effort that you have done. So do put in enough equivalent efforts also in the dissemination of this. So even if, let's say, you create a portal and you put this all, rather than sharing this presentation in the final dissemination effort, making this communication that we create this library that all relevant policymakers have access to in the long term, and this library continues to get built. So you put the map that you have right now, but there's an ongoing process to keep enriching that map, and a person working on nutrition knows that this map exists on IDC website, and he goes there and sees what is available to me. That's all from me.
Okay.
Thanks for this.
I just want to, we can address and then you can incorporate questions here. Otherwise, I will forget. Sorry. So over the context, Neeraj, what we are talking, I will give you an example on routine immunization studies, which is also commissioned by 3I and did by JPAL. That routine I already mentioned in the scoping also, that routine immunization studies, what they did, they take a look on the programs and intervention, in a sense, what exactly happened before and after, what they lack in incorporating the community on that particular campaign. Like, that intervention gave you details, okay, having a dose actually create a great change, but that study didn't give you information, okay, on what context that people accepted that dose. Because in Bihar situation, if you take a look on NFHS 4 round, so you will feel like the routine immunization is not that good. What are the things happen in Maharashtra and Karnataka? It's not the same. Okay, over routine immunization also, people spend a lot of money over campaigning and also on community mobilization. So if you want to replicate or if you want to use that evidence of 3I studies on routine immunization in Haryana and take the learning of Haryana into Bihar, it's create a problem. So for this I stated that study was not able to give, I'm just giving an example. Okay, it's okay, we understand RCT is one of the gold standard, but it's also have problems that is not able to give us information on what context, on what are the factors of worked to run a program successful. So like that, and over your information over the descriptive evidence, yeah, after the TNA, you were the one who will helping us for implementing the descriptive evidence part, as we discussed. Though I believe using the descriptive statistics in building the local researchers' capacity will actually be very helpful. And over the scoping paper, in the folder we shared the ideas for India. So in the ideas for India, what we started doing, we started putting all the information of this particular program, like we already uploaded the draft scoping paper for people's feedback, for researchers' feedback or anyone's feedback. At the same point of time, we started doing a roster. Like Manish and I started doing a synthesis paper. We start synthesis in a sense, we just take a look on, suppose on agriculture. Okay, we already mapped out the peer-reviewed articles. At the same point of time, we started building what are the existing research commissioned by IGC in Bihar and also on India level. And we also started take a look on Scopus and Web of Science, and we will use basically top 15 top 15 articles which are already used by or referred by other researchers on their research. And those things are basically, suppose in agriculture, it's access to credit, and on access to credit, what are the top 15 articles in Scopus and Web of Science? And like access to credit, access to input, access to financial services, like that way we figured it out, all the articles. And we will come up with again another synthesis paper on each sector, and then we will start putting those things in the open port, in the ideas for India side. So I believe on that, like 3I riddle or the 3I database, we will come soon on the existing research already happened in the world and also in the Bihar level and also in the India level.
Hi, thanks for your presentation today. There are a few things. Before with that, I'll just introduce myself. My name is Shashwat Gautam. I'm a director of Advanced Analytics Unit for Public Finance at Center for Economic Policy and Public Finance. There are a couple of things which I would like to talk about. One was the Like, for example, I'm going through your evidence, need, and suggested research areas, and I go specifically into agriculture and inclusion. So there, when I look at it, see, the biggest concern of agriculture community across Bihar, I mean to say, if you go into any discussions in the state assembly, the biggest factor has been the price of agriculture commodities and the pricing. And it's not there. So when you say that you have an evidence gap and in-depth stakeholder consultations, when you're claiming that, and when you are missing out a basic fundamental issue, something like that, I think that's a matter of concern. And as I would also say that that needs to be reassessed. So whom we are calling stakeholders? Because see, not very long back, we have a meeting of all stakeholders of Bihar for Bihar's demand from 15th Finance Commission. In that meeting, the 2 or 3, I mean to say, because I was there, 3 major areas which were really, really important and exorbitantly discussed at very great length was agriculture pricing, and then the issue of, say, riverbed siltations. Of course, I understand that your domain may be certain skewed and based on the different kinds of research work which has already been done. But I'm saying that when we have this kind of a focus based on what has already been researched, we actually bypass the actual needs of the state. So in theory, your work would look great. I mean to say, it would have wonderful presentation and probably there will be more in research areas, but that's not going to help Bihar in any way. Okay. So that's one point. Second, very specific example I would like to give. So for example, in Bihar, and I'm heading that unit for whole data for Bihar government, supported by the Department of Finance. There's not a single data of agriculture pricing and commodities in Bihar. There's just not one. There's across the mandi, Bihar government, even the ones which are presented in economic survey, they need to be reviewed. So something like that. So when I go back and look at your section chart 3 area that needs more evidence, and you say technology and agriculture at 30%. Now how you come at 30%, again, we need to review and reassess.
Okay. So
and just let me complete one final point. And one final point would be, in general, Bihar, from economic and public finance standpoint, socio-economic indicator standpoint, the upkeep and data governance of research data is almost non-existent. Yeah. For most part, you yourself presented that a lot of researchers were claiming certain things based on their own anecdotal evidence. So there is no scientific way of data collection across different departments. If you ignore the public finance data, if you ignore that, so for example, even healthcare data, agriculture data, a lot of it is coming from very sample set. So if you can prescribe to the government department about better data governance protocols, which can help the researchers and academicians and other institutions and suggest government in policy formulation, that would really help quite a bit. So these were my few points. Thank you.
Okay. So over the price,
Kumar, I would just like to add to what he said. Maybe that would help you answer. The database issue is really very, terrible. Bihar is in a terrible state with respect to that. You pick up any topic, you want to research something on Bihar, district level data, village level data are very hard to come by. Reliability of the data set, robustness of the data is questionable. And it's not that in the world we do not have examples where such explicit data sets have been built up. And since IGC do want to venture into that field, you can take a look at, there are religion data sets all over the world, across countries. There are globalization databases. Right? So all you need to have is a common question, a common questionnaire, a common method of collection of data. Right? And see, a database does not aid one researcher. Yeah. I have finished that research. Once you have access to that data set, somebody else have access to that data set, it can be put to some other use. Right? It can be used multiple times. And for a state like Bihar, where every area has got a different question that needs to be looked at, a common data set can be very helpful. Right? So, and like you have been from the beginning talking about building a sustainable ecosystem. But the moment you categorize, by topics, like education came up, APMC came up. So instead of categorizing this, for example, you have said violence and women. Now, very recently I figured out that even to have a proper research work on women empowerment, I need data on religion, because when I do the empirical testing, I need instruments, and there are certain criteria of which variables I can use as an instrument. Those are econometric specifications. Religion turns out to be one such variable which I can use to measure women empowerment. Now, when I started the research, I had no clue that I would need data on religion. So what do? At the middle, I leave the research at that. I again start a survey to get data on religion. That's absolute mess. So if I already have a data set, it aids my work. So instead of categorizing it into some silos, you just, when you're saying it's based on demand, why not just keep it open and, for example, you are talking about access to credit. When you think of access to credit, one of the major issues that comes up is property rights. Yeah. But you have nowhere talked about property rights. Right? But without that discussion, access to credit becomes, you can't have policy implications then. It will be a research, very good to look in paper, you might upload it somewhere, but it will not have policy implications. Okay. Right? So, just don't make this silos, because then, like I said, I'll be stuck in the middle.
Yeah.
Right? And second is, if you have a data set which is prepared by somebody, it's better that we keep it open for other researchers to be used. Right? That helps a lot.
Yeah. Okay. For Shashwat, over the agriculture pricing and issues of commodities, actually, over the agriculture thing, we only had conversation with the secretaries and APC from the agriculture department, and IFPRI, IRI, and CRS, who are based in Bihar and working in Bihar. And
see, my only point is that then it's again a very misaligned.
No. What I'm trying to say, just listen first. So we, based on the conversation, whatever they stated, it's not our opinion. Whatever they stated, we put things in the paper. Okay. The second thing, over the 30%, suppose how we calculate, you ask me the question. On agriculture thing, we have 10 respondents. Out of 10 respondents, they stated they need information, they need more studies on agriculture or role of technology. So like that way we calculated. So the objective, this is the basic objective of this stakeholder consultation. We also feel like, as Meghna stated, it's not possible if you want to create an ecosystem in a state, it's not possible if you are working in silos, like on only particularly health. We know how agriculture and health is interlinked. So if you only working on health or financial inclusion and ignoring one of the another side, would actually not helping this, will not help the state in a way. Over your another question, over the data set, as Meghna and you stated, Manish and I already started the data mapping exercise. Data mapping exercise of all existing data which are available in the departments, with all the government data set, and after that we again, after I think 3 months, we will start having conversation with researchers and also with organizations who currently working in Bihar, if they want to share their dataset with us. Sharing dataset, in essence, we will create an online portal and we will put those things. And if you don't have a problem, so then anyone who want to use that, so they can just take a look on the site. And it's more look like a replication window kind of thing. There are did for the data management. So there is already did, and if you want to again to take a look on particular things on that particular survey, we can help you. So, but these are still we are trying to manage, like over the data thing. I think we need another 2 months to complete the data mapping exercise of all the government departments, because we are currently busy on the synthesis paper of agriculture, nutrition, like that way as mentioned. So once we complete the data mapping, I think that will help the researchers more in a bit, because that give information from where you get the data, what are the things available on that particular data, and who will give, whom to contact, like that way. It's just about information, and then we will start having networking with other people who, if they want to share, so then we will make a storage of that. So like that.
Basic idea of having quality, because now data in itself has become an empirical and an absolute subject domain, which is like applicable to every single research you can think of. To have something like that here and highlighting it from a subject neutral standpoint would really help. across the domains. And second thing, this is a small comment that when we say who are the stakeholders, see, to be honest with you, and with all due respect, I mean to say the civil servants in Bihar, or for that matter any government, are not the best people to refer to, especially when it comes to assessing. I'm being very honest here. I mean, they would not know what are the implications of APMC Act for different commodities. Because see, they are working from a very different perspective. So when we are deciding who are the stakeholders, or at least for every single domain, the actual people who are being impacted. So for example, agriculture, there should be like a group of 20-30 farmers who should be giving you the insights on the areas of research where it's really.
But this is the limitation of the scoping paper. We only had conversation with the department secretaries, PS, or NGOs, INGOs, or even bodies who are currently working in Bihar. We are unable to conduct the primary survey on each and everything. I understand that this is the limitation of the thing. And over Meghna's answer on the the property rights and access to credit, yeah, we also feel like see, access to credit is a huge idea. So what we decide in the call for proposal, we will only put agriculture. Suppose I'm just giving, because still we need feedback from everyone. Okay, we put access to credit, but the researcher should give us the question: okay, is it good to evaluate like the property rights and linked it with access to credit? We are not giving you any questions or thing. What the stakeholders stated, we just put that information. It's not our priority. If we and the research, unless the researchers give you a proper question, it's not possible for us to commission a study. So access to credit is a huge area. It can be linked with farmers, it can be linked with healthcare, like that, everything is linked. So if the researchers give us an information about the access to credit and as Meghna stated, and they linked it with the property rights, that gives an IGC, and the government will help anyway, yeah.
So I have a couple of questions. So this is Vinod from Cornerstone India Foundation. So this paper has been generated it looks very worthwhile, and you have done a rigorous job on that. I have few queries about when you talk about, because majority of people have felt that areas required for further research is more on health and nutrition, right? Does that, when you say health and nutrition, does that health covers mental health?
Yeah. So see, if you take a look on the possible research areas, we also put mental health.
Okay.
So like health, what we did, health, nutrition, sanitation, we club. This is a whole theme, and on the whole theme, there is a sub-themes. On that sub-theme, we mentioned mental health, because we had conversation with the ED, SHS, Lokesh, I think Lokesh Mr. Anyway, we had a conversation with the principal and also with the principal secretary, and they stated also, okay, because nobody start working on mental health. So commissioning studies on mental health will help Bihar also. So we put mental health, but this is not our opinion. It's the government and the researchers stated that they required more evidence on mental health, like that.
Yeah, good. And other question is that referring to the chart 2, I'm very happy to see this, that most of the respondents, they mentioned that they are using the M&E data, and also nearing about 40% they mentioned about that they are using qualitative data, which is very, very important for successful of any program, because it comes to when you think of scaling off of any program, then you need to look for the evidences, particularly based on the qualitative data, right? So I think that should also be the major focus on that when you commission any research, and people should come up with the focusing on qualitative research, right?
Okay.
Yes, thank you.
Thank you.
Good morning, everybody. Kumar, thank you for that wonderful presentations. I have a couple of observations. I think this kind of associations. So I think, I believe the overall aim of this exercise is translating evidence into sustainable implementation through some policy recommendations, right?
Yeah.
So you did a research of the peer-reviewed articles over the last almost 2 decades, right?
Yeah.
So when you're looking into the methodology sections, so it will be very nice if you can specifically categorize mention out of how many articles you have selected.
Narrow it down.
Yeah, in terms, and also, and how many you have discarded first
And
of all.
what are the reasons?
What are the reasons, possible explanations for that? And also, since, health is a very complex terminology, and it has a plethora of many things. So instead of, health putting into broader terms, if you can categorize it, say for example, if you're looking at the service delivery, so it can be either curative, preventive, or promotive. So you're focusing only on the curative, and not only focusing on the curative, but the promotive and the preventive part, right? Even if you're looking at the population, who are the vulnerable population, say women, say children, then you can say geriatric population, adolescent, they are the most vulnerable group of population. What kind of services they are receiving? Because I believe Bihar is a step ahead in compared to other states, because many of them are development partners are working in Bihar. And we have lots of data, right? And I think instead of you did a peer-reviewed thing, that's fine. But I think there are many gray literature also, and the NGO, since you have also a qualitative component in your exercise, I think while interviewing them, what data has been taken up by the government over the last 2 decades, that will also help us to understand what kind of the research areas government is focusing or interested in. And also if you can specify the domains also, say for example nutrition, the maternal health, child health, adolescent health, that will help us to be more specific, and what are the research needs and gaps, and what are already in place, and what needs to be done. So you can identify specifically what is lacking, instead of picking a very broad things. So we can focus on that also. And when you're in the methodology, when you're describing the inclusion criteria, I think you need to be more specific. What are the things you are taking? What are the things you are discarding? And also the analysis part, whether it is purely a descriptive part, and if you are describing it, what are the numerators and on the denominators? So that will not give us the impression 30% of all are happening at that level. So that will help you in enriching your evidence base. Thank you.
Overviews would narrow it down these the articles. So what we did, because we didn't share the annexes in this scoping paper, what we did, we take a look on health and then Bihar, and also then put suppose service delivery. Then we put home visit. So like I'm just giving an example. And on that point of time, suppose in Web of Science, there are thousands of articles on home visit, Bihar, or health. But when we take a look, mentioning health, mentioning service delivery, supposing, because how this web database works, it just pick up the main point, mentioning service delivery as one of the keyword. But that if those articles are not addressing service delivery in whole, we didn't discuss them. So like that way we worked. And so we will put those details, how many articles we got in first, how we narrow it down in the last, and why only 224 articles for this huge amount of work. Over your subpopulation, we already mentioned in the scoping. While take a look on these peer-reviewed articles and we are not able to get those information, how effective those interventions for, suppose in Mahadalit. Suppose your work is on generic, but how if that particular program, if you want to implement on Mahadalit section people, is it give you a proper rigorous evidence or not? Is it possible to implement or not, like that way? Over your information over, what is the last question? Sorry, I didn't. Okay, over the analysis part. So we will. Yeah, because actually what happened for the stakeholder consultation, we circulate emails to everyone through our dataset. Based on that, we get on agriculture, because it's come from agriculture over 30%. Based on that, we got only 7 people give a response on that. So then we started having conversation. Because after doing follow-up thrice, we only get 7 stakeholders on that particular thing. So that information based on only 7 respondents, I mean 7 different organizations. But it's a good suggestion. We will put 7 different organizations at the same point of time, the name details of the respondents, suppose number 10, because from IFPRI we had 5 different people, stakeholders, means 5 different people give us information. So like it's a 7 different organization, but when you put the numbers together, it may be 15. So I will give you the details later on. Yeah.
Chandan from Oxfam. Thank you for such a nice presentation and also the scoping paper you shared earlier. So I have one suggestion. As you know, the Bihar is most flood prone areas. So we had also done a study on the SRHR issue in 2 to 3 districts. So we find whatever the things in the normal days, in the peace time, and that is worst in the flood time. So if the scoping paper also include the vulnerability in during the disaster, so it will also see what is the different kinds of policies that being implemented or impacted the people life in the peace time and also in the disaster time. Secondly, when we have a study in, when we have discussions in around a thought within our team, so we are saying that after divided from Bengal and Bihar came out in 1919, and at that time we are saying that Bihar is one of the state we have a good indicators in everything. Now it is depleting and it is lagging in every indicators. So at this point of time, we also have to think in that way, in a broader framework, what had happened to Bihar. Even in the political scenario, maybe in the resources we are having crunch of, people migrated. But the thing is, what had happened in the Bihar, that is, all the indicators are just, we are lagging in everything. Thank you.
Okay. The thing is, we will incorporate, because over climate change and environment and the flood things, we only had a conversation with Oxfam and also with Nalanda and also few Delhi-based organizations. And on that, they stated environmental vulnerability. But for this, we put environment and vulnerability or climate change. But we didn't give you the details of, okay, if it's a flood-related, like, when we had a conversation with Nalanda, they stated more in, they want to do research on wetland things in Bihar and what are the things happen there, what are the environmental problems. When we also had a conversation with them, they also stated about the environmental microplan, climate change microplan in Bihar. So like that way, we put only climate change and environment. We didn't incorporate the details of that. So sorry for that, but we will incorporate that in the call for proposal.
Because we had seen that when we had that study on SRHR in Kadia, we see that although there is an institutional delivery, it happens, but during the flood time, it's around 15 days, they don't have that. Even though we can't say about the same delivery also. So that needs to be seen from that time.
Okay. We will incorporate, sorry for that. Yeah.
Hi, good morning to all. I am Sivendra. I am Program Manager from UNICEF Bihar Field Office. Thank you, Kumar, for a very nice presentation and sharing of this scoping paper. Just few reflections from Bihar perspective, and that too limited to the scope of the studies, not going into the methodology, sampling, etc. That I was just looking from that it has very well captured the domains, themes, and the sectors, but I was looking from the one area which is very important for any of the programs and scheme is the governance. So I don't see anything related to governance when I am reflecting on that. I mean particularly about the panchayats, because of this 14 finance commissions and the state finance and all. This has a very major role to play in any of, irrespective of your health, education, nutrition, etc. So I was wondering that is it within the scope of the work that we can think of taking one. The second, again, very relevant to Bihar, and certainly you have to take concurrence from the government and all, but reflecting about this, one of this women empowerment, poverty reduction and all programs, the Jivika has been prevalent in this state since more than a decade. And gradually it has covered many issues, starting from economic empowerment, now entering into the nutrition, health, and we all are latching upon the Jivika's intervention being a development partners in. As this kind of community platform, how this is really tackling the entire issue of health, nutrition, poverty, economic empowerment. So that could have a very big evidence for the state to see what we have done, what we have achieved. I don't know any research on that has happened or not. till that, or there may be some, so I'm not aware of that. The third thing again, which is again cross-cutting kind of thing, is about this planning.
Yeah.
Because we are always intent by our, as a professional bias, to evaluate post-implementation. But when it comes, the efficacy and efficiency of the planning, if you have a wrong planning mechanism and a wrong plan, and then you implement and then you evaluate, there is all probability the results are not likely to be there. You may have a very good evaluation research study, but can we think of what is the mechanism for the planning in the state, how this planning evaluation?
Okay.
Is this, because if you are talking of the theory of the change, the theory of the change should start from the planning. It's not the post facto that you implement something and then you evaluate on the theory of the planning. So that could be another area. I'm saying that it may or may not be within your scope of the work, I don't know. But that's just a reflection that is coming to my mind, that in terms of the planning, how do you plan, irrespective of being a planning department or the other health departments, what is your entire, so that also need to be evaluated and seen. Can we do a more robust result-based planning? What is the evidence for that? How departments are planning? Thank you very much.
For your first question over the governance and the panchayat one, the thing is, over governance, we got information on the nutritional governance, because you mentioned that, but for other sectors, we are not able to get those information. But it's a good point, because after the 15th Finance, because in the 15th Finance Commission and with the Panchayati Raj, we should take a look on that. But I will just add one study here. Okay, after the reservation, women's reservation, 50% women reservation in Bihar, well, I think last year, Jaipal conducted a study, it's a very good study, on impact of women who are responsible in their panchayat, what exactly happened with them. Means it's the difference between elected women panchayat leaders versus their male counterpart, and is if those panchayat are more effective or not. That's a very good study. So we are also thinking to do the same kind of study again, but that in Bihar, but particularly take a look on the sanitation part, because under the Swachh Bharat program, everyone is talking, but we don't know what is the effectiveness of this program, because it's a campaign mode. Over Jivika and HNS, I'm also because everyone is talking about Jivika as a community. We know Jivika is running well, because it's reached the grassroots. Their economic empowerment activities are running well in a very good way for the last one decade. But the problem is, when you take a look on the particularly health, nutrition, sanitation on Jivika and how this platform are working, we don't know, because I hope you know the Gram Bharta program of DFID. So 3I commissioned the studies on the Gram Bharta intervention impact and they evaluate the thing. So they stated that there is an enormous result. There is a very good things happen because of this incorporating HNS in the community platform of Jivika. But what we are thinking were, okay, everyone is working on the community platform together. So you are creating a burden on that particular Saheli, and because you want to work on health and nutrition, because you don't have a separate Saheli for that. You want to work on the economic activity, you don't have a separate Saheli. So we are thinking to take a look on how this Saheli's educational qualification and also the burden part can help or with the state like that way. But we don't know how this community platform works basically, because now PCI is working on this Jivika platform. DFID already did. We don't know that. Over this planning, we already started having conversation with the planning department, principal secretary, and also with the directorate of evaluation to strengthen their capacity. And with the TNA, training need assessment of all the stakeholders based in Bihar, we get to know over their existing knowledge and the gaps in their knowledge and how to proceed further. So because in the presentation I also stated for the local capacity building, we don't know whom to target. Like we only target the researchers or the development practitioner or the mid-level or junior level staff. And so unless we do a TNA it's not possible for us to how we can proceed further with the planning department and also with other department in their planning process. So we need more time. Unless the TNA process is completed, we are not able to give you more information on that.
Hi, I'm Papia Raj from IIT Patna. I think the scoping paper is very commendable, but I just have a few points that came across my mind. Like when you talk about the access to healthcare, I think it would be really nice if we also could include the issue of availability. Because if we are not talking about availability of healthcare services and we are just talking about the accessibility, we are just looking at it from a one-sided view. And we know it's a big problem, especially in a state like Bihar. So I think it would give a better understanding of the healthcare situation. Now, the second thing that I would like to mention is about adolescent health. Now, here we talk about anemia and abortion, which is already part of the reproductive and maternal health. So, but I think adolescent as a group is very kind of important for a population like India, and we need to provide a holistic understanding of adolescent health rather than just focusing on the maternal and reproductive health. So we need to move beyond the NFHs and this type of studies that have been carried forward. And the third thing is when you talk about quality of care. So most of the studies that you have considered are what is available in fact, is they talk about maternal and child health. But I think it would be really interesting to see the quality of care in the different levels of healthcare. Here we are just talking about primary. So what about the secondary and the tertiary healthcare? Why are we kind of excluding the other age groups, because we know with the change in the shape of the population pyramid, we have a considerable proportion of aging population also. So I think like if we can make it more population specific, more level specific, then it would be, it can make it a little better. But it's really commendable what you have done.
Okay, over the availability part, the thing is we just said, okay, we put the thing, the researcher should give us a question. It's not, because when we had a conversation with the stakeholders, they stated they need more studies on the availability, on the quality of care, like that way. And in the call for proposal, what we are expecting, suppose we put health and we put access to care, and the researcher should give us a question on that. Okay, like if you want to evaluate, if you want to take a look on access to care and with quality of care, if it's depend on the researcher. So it's not our domain to give, because then it's a consultancy. We don't want to put our thing into that particular domain. So it's a researcher's job. They should come up with a proper question, and then we will take a look. But over adolescent, okay, we put anemia and abortion. So there are plenty of studies on abortion in Bihar. But we don't know what is the implementation mechanism of the abortion law in Bihar. Because, in Bihar, if you take a look on the NFHS 3-round youth in India, they stated that abortion rate is high. At the same point of time, it's not in the government or in the private, it's very low. In the government is very low, but because of that, we know there is a mushrooming like this clinics, and we don't know the effectiveness of this clinic. What exactly happened with people who are opting for these clinics aftercare on the aftercare side? So like that way, on the adolescent side, we've realized we only limited things, but at the same point of time, I will say in the last chapter, we also put under adolescent life skill programs or SRHR program, anemia, WIPs, everything together. So this section is basically what the stakeholders stated. It's not it will not give you a whole set of information. So like the last chapter will give you information where we clubbed things in a way what stakeholders stated, what are the gaps in the evidence, we put the details. It's look like a laundry list kind of thing. So this is the thing. And over the quality of care, I will say it's the researchers again. But now after having this stakeholder consultation, what we feel it's better to just put health. So the researchers should give us a question. It's not possible for us to give a sub-theme, like we missed education also. And we also know how this education and health programs are interlinked together in any in Bihar context. So like that way, we just only put then health as an open area. So then researchers should give us a question, yeah.
So I'm Manish, I'm a program economist at IGC. So the basic idea of first of all, thank you for the comments. Like, it's really wonderful to get some good comments out of it. So the basic idea of the scoping paper is just to like start this conversation of how we can come up with evidence-based policy research in Bihar. This is not like the only thing which we are considering. This is just a benchmark we have put in. Now, the call for proposals based on our discussions which we'll be having, and also which we'll be having at a regular phase, will enrich our knowledge and also your understanding and your expertise on different areas which you have will help us to commission research in these areas, which can help us to create a more influencing policy making, like a policy making which we can influence in Bihar. So this is our main agenda. So the points which Meghna has made, the point which Papi has made, the point which Shailendra has made, this Shivendra has made, these points actually helps us to enrich more of our knowledge in building up a more evidence-based policy making. That was the meeting which we are having it. So don't consider that this is the only thing which we are doing. This is just giving knowledge, current knowledge, what is there, and how we can go ahead with it. So the data one which you said, yes, there is a problem of data. And our two workshops, like data workshop, and also the Patna school which we'll be considering. So this will also be a good way of starting out that how we can like map the data properly, and also which data can influence policymakers or which data is required for the policymakers. So this is what the agenda is, and I think we are having a good time.
Saritra from CARE, because thanks for sharing your findings from your rigorous research. And because we work mostly in health, so my question is also health related. I was seeing that like we have split like say health related categories into different domains like
Sorry for
maternal
that,
health, neonatal health, then there is quality of care and also gender and health. Now if we are looking at these individual domains, they seem fine, but like once you were like talking about like this policy implementation and the influencing the policy, then maybe like I didn't see any sort of overarching domain, like say overall improvement of the maternal and neonatal. Because although there is mention of this cross-cutting areas, but like what about this attribution of like investing in these individual domains? Like say if like investment is made in gender and health, like as on a priority basis, what sort of improvement is that going to bring to overall maternal health? Or say if just investing in maternal health, how is that going to influence gender and health? And also what about the prioritization? Like say if in like this one is attribution, like say investing in gender and health is going to bring down maternal mortality by this extent. But like say if someone is going to invest like in all of these domains, but what would be the priority areas? Like whether they should first be investing in gender, improving the gender equation, and then moving on to maternal health, or whether someone should be like investing first into improving the overall healthcare services and then for going into the finer details like improving the maternal healthcare services. Okay. Like I didn't find any sort of like, as Manish just mentioned, this is just the beginning. So maybe like, but this could be an area where the future research can look into.
Yeah, so I will add one thing over the gender and health, because first you want to work on gender equity part or on the health side to improve the situation. We don't know that. So as I mentioned earlier also, okay, for the research, while we're commissioning research or when we opt for the call for proposals, researchers should give us the information. Okay, if you want to experiment that particular thing, okay, investing in gender equity give you more benefits or not, or you just need to start incorporating or investing more into health to achieve gender equity part. You got my point? So like that way. So we don't give those kind of things information. So what we started previously, think, okay, we will put the details like gender and health, but on gender we put only social protection, and under social protection everything is included. So we realized giving certain areas or mentioning certain areas in call for proposal is actually create a problem for state and also for policymakers and also for us. Because if you put health, then the researchers can come up with a very good questions. And if you just narrow it down only on quality of care and health, then maybe researchers may face a problem. because you narrow it down everything. So like that way. So if you want for the gender and health part, okay, where you need to invest more, I will suggest apply for the grant, because you will come up with the grant. So then that gives a new study and also new research areas, and it will help the state where to invest first. Yeah.
Yeah, there are two points actually. I am Shashwata from CHP Agri. One is the determinants of the child nutrition. I mean, while actually searching the literature as well as doing the work, what I have came across that the conventional determinants like the maternal level, child level, household level, all those levels, and as well as the accessibility, ICDS, all these things can only explain the phenomena of the child stunting or this thing up to say 14 to 26%. So remaining 75% is actually unknown. And the thing is that in this particular situation, these contextual factors come into force. So the point actually raised by the flood, I mean the flood or the drought or any other natural calamity, or say PDS uptake in a particular district, or all those things. And maybe there are several other factors that has to be actually understood in actually very, I mean, rigorous quantitative survey as well as some kind of ethnographic studies. I mean, otherwise that there are cultural phenomena are also there. So all those things has to be understood in actually very detailed manner. This is one. And second one is the TFR, total fertility rate in case of Bihar has been plateaued. I mean it from the last 1 decade it has been plateaued at 3. So it is not coming down less than 3. So now the question actually remains that even after pumping so much of money, this and that and whatever we are doing, so many agencies are working on, starting from the TSU, Technical Support Unit, so on and so forth. I mean, it is not only about the contraception or to the maternal health or not, there is something other things. So, if you see the example of some other states, like in case of West Bengal per se, that the contraceptive, modern contraceptive uptake has actually declined, whereas the fertility rate has also actually declined. So, there is some other thing. So, in this case, this the phenomena of sun preference, as well as the land holding pattern, okay, and as well as how that microfinance activities can change the sun preference. Those may be very interesting and emerging areas of research. That's all. Thank you.
So this is the thing. We also started feeling like, okay, if you give a broader area, then it's narrow area in the call for proposal, it's create a problem. And as I also mentioned, the context and factors which not addressed properly in maximum cities. So I will suggest, okay, in the call for proposal you should apply for that. Then we can take a look on further things. Yeah.
Thank you for sharing. This is Gunjan from C3. I'm sorry I'm asking this question in spite of listening to so many questions and your answer. I agree you have, in this scoping paper, we have talked about adolescence, we are talking about nutrition. But do you think child protection should be an issue since we are talking about evidence-based policy planning?
Yeah, obviously. With child protection, I will say, because previously I worked in child protection. So we only address child marriage. But then we realized unless you address issues of child labor or child rights, it's not possible you are addressing the whole thing as a children. So maybe in the call for proposal, as I mentioned already, we may say children. So then the researcher should give, okay, if it's a child rights or is it a child labor related research, or if they want to do conduct research on child marriage only. But when we have a conversation with UNICEF and also on plan on child rights things, so they also emphasized more on child marriage. And also few of them emphasized on the JJ implementation part, okay, how this state mechanism is working. So like that way. So this is the part, So this is the thing we will say. In the call for proposal, we may mention, because we have a one section on policy and regulations, and under the policy and regulation, it should be the JJ Act or ICPS will come together. So we didn't mention JJ as separate or ICPS as separate. So, but in the policy regulations, it should become, yeah.
Thank you, Kumar, for covering so many thematic areas in your scoping paper. I have only a couple of suggestions which I wanted to see. If these researchers can help government of Bihar for their specific programs, because as we know that few of programs are very state specific in Bihar, like Kaushal Yuva program, then the social forestry model which is being implemented in Narega. So those schemes, maybe like this research, somewhere it can be researched and let other people to know the findings, and maybe those recommendations can help government again to execute the programs in a better way. So maybe you can consider including skill training programs or Bihar Skill Development Mission, because this Kaushal Yuva program and Recruit, Train and Drives, RTD, these two models are nowhere in India. So maybe like, and it's already 2 and 3 years, it's already over. So maybe it's a good time that sometime mid-term evaluation or some recommendation should come.
Yeah.
Thank you.
For this, I will say, as I mentioned, we have a small project facility. But for the small project facility, when the research is applied, because I will give you later I need another 5 minutes to discuss over the research grant part. For this, under the small project facility, if the department is willing, like as you mentioned over the Kushal Yuva program, if the department want to evaluate the program, so it's welcome, because you want to work on the state capacity part. So if the department just send a mail or just a letter that they want to take a look on particular initiative, so then we can go further with an SPF, because the SPF is basically for us, it's a matchmaking. So there is a policy makers want to evaluate particular things, and in another hand, then there is an availability of researchers, and then we connect both of them. Like that way we used to work previously, and this time also we follow the same process on the SPF. But for the larger grant, it's not like that. It's a call for proposal kind of thing. So the researcher should come up with the questions, and then in the application form you need to give details over the policy part of it, like policy influence plan. But I will suggest, because this NSDC part, or because this is government need rapid response on that, or government need an early response as soon as possible kind of thing. The larger grant maximum time is not suitable for that. So I will suggest you can take a look on the SPF, small project facility, for a particular thing.
I am P. Prakash from Department of Planning and Development. Thank you for inviting me. राष्ट्र की नीति योजनाएं जो बनती हैं उसमें रिसर्च का बहुत बड़ा योगदान है. योजनाओं के कार्यान्वयन के बाद हम उनका अध्ययन करें, ये रिसर्चर का काम नहीं होना चाहिए. मेरी समझ में रिसर्चर का काम यह होना चाहिए कि योजनाओं के लॉन्च करने के पहले, हमारी पॉलिसी फॉर्मुलेशन के पहले, हम रिसर्च इनपुट ऐसा दें कि हमारी रिसोर्सेज का बेस्ट यूटिलाइजेशन हो सके. बिहार की बात करते हैं तो यहाँ पे जब सरकार रिसर्च इंस्टीट्यूशंस को खोजने जाती है तो सबसे पहले मैं देख रहा हूँ यूनिसेफ आता है, आदरी, एन सिन्हा इंस्टीट्यूट, और कुछ ऐसी ही संस्थाएं हैं जो पटना बेस्ड हैं. CIMP रिसेंटली अभी इवॉल्व किया है. यहाँ तक कि यूनिवर्सिटी जो है हमारे यहाँ, उनका भी बहुत कम उपयोग हम लोग कर पाते हैं. आपने रिसर्च बेस्ड जो डिस्कशन रखा, यहाँ पे आपने एक अवसर दिया है कि हम पूरे राज्य के संदर्भ में रिसर्च के महत्व को समझ सकें. मैं आपको इसके लिए, इस इनिशिएटिव के लिए धन्यवाद देता हूँ. हमारी पॉलिसीज बनाने में, अध्ययन करने में, हर चाहे शिक्षा का क्षेत्र हो, स्वास्थ्य का क्षेत्र हो, या बुनियादी सुविधाएं देनी हो, हमने कुछ अध्ययन किए थे, लोगों के कुछ व्यूज लिए तो 7 निश्चय लॉन्च किया. आज देख सकते हैं कि बिहार की जनता को एक समान सभी तरह की सुविधाएं, समान तरह की सुविधाएं उपलब्ध कराई जा रही हैं. सभी लोगों को नाली गली, सभी लोगों को एक समान बिजली की व्यवस्था, पंचायतों में विद्यालय, हाई स्कूल इस्टेब्लिश किए जा रहे हैं. तो इस तरह के सभी सुविधाओं को एक समान रूप से राज्य सरकार उपलब्ध करा रही है, एक इंफ्रास्ट्रक्चर बन रहा है और इक्वलिटी बेस्ड अपॉर्चुनिटी उपलब्ध कराई जा रही है। राज्य सरकार की नीति रही है ग्रोथ विथ जस्टिस, राज्य सरकार इस पर काम कर रही है। इसी बीच में हम लोगों ने सस्टेनेबल डेवलपमेंट गोल को, जो गवर्नमेंट ऑफ इंडिया ने रेजोल्यूशन को अडॉप्ट किया, हमने भी उस पर काम किया। नीति आयोग के पॉलिसी इंक्लूसिव ग्रोथ, इसमें कॉम्पिटिटिव एंड कोऑपरेटिव फेडरलिज्म को भी हम लोगों ने अपनाया। जो हमने एसडीजी विजन डॉक्यूमेंट बनाया उसमें आदरी ने बेसिक काम किया था, उसके बाद यूनिसेफ ने उनको इम्प्रूव करने में हमारा निरंतर साथ दिया है। हमने वो डॉक्यूमेंट नीति आयोग को भेज दिया है। हम महसूस करते हैं कि हैदराबाद जब इंटर करते हैं तो करीब 300 से अधिक नेशनल लेवल के इंस्टीट्यूट दिखाई पड़ते हैं। बिहार में कितने इंस्टीट्यूट्स हैं? वहाँ हमने महसूस किया नेशनल इंस्टीट्यूट ऑफ रूरल डेवलपमेंट कि यूनिवर्सिटी के बच्चे हमारे साथ बैठकर ट्रेनिंग ले रहे हैं। यहाँ पे आप लोगों को कितना अवसर मिला है कि आप ट्रेनिंग दे सकते हैं अपने छोटे भाइयों को। तो एक रिसर्च का एक माहौल बनाना है। इवैल्यूएशन डायरेक्टोरेट 2010 में अलग से शुरू हुआ था। पहले सांख्यिकी और मूल्यांकन निदेशालय एक साथ था, इवैल्यूएशन डायरेक्टोरेट 9-10 में शुरू हुआ। उसके बाद अभी तक 18 स्टडीज करीब करीब पूरी हो चुकी हैं। वो गैप्स क्या हैं, हमारे रिक्वायरमेंट्स क्या हैं, यूनिसेफ ने बहुत दिन तक सपोर्ट किया था। आगे सपोर्ट की क्या आवश्यकता होगी आप बात कर सकते हैं। प्लानिंग पे यूनिसेफ ने बहुत अच्छा क्वेश्चन रेज किया, हमारी प्लानिंग की व्यवस्था क्या है। तो ये एक ओपन क्वेश्चन है, डिस्कशन का है कि ये देश के हित की बात है कि हमारी प्लान फ्रॉम बिलो की बात हमेशा करते रहते हैं, रियलिस्टिक प्लान की बात करते हैं। तो रियलिस्टिक प्लान क्या है, कैसे होना चाहिए, एक लंबे विषय की बात है और हम इसको कैसे अडॉप्ट करें नेशन वाइड। केरला का क्या मॉडल है, हमारा क्या मॉडल है, क्यों कोई राज्य ह्यूमन डेवलपमेंट इंडेक्स में बहुत ऊपर चला जाता है, कोई राज्य इसमें पिछड़ जाता है, यह अध्ययन की बात है। बिहार में सबसे ज्यादा पॉपुलेशन डेंसिटी है। इस पॉपुलेशन डेंसिटी में एम्प्लॉयमेंट एक बड़ी समस्या है। एम्प्लॉयमेंट के लिए एंटरप्रेन्योरशिप को कैसे बढ़ावा दिया जाए, यहाँ इंडस्ट्रियलाइजेशन को कैसे बढ़ावा दिया जाए। यहाँ के बच्चे बाहर जाकर बहुत अच्छे कर पाते हैं, लेकिन बिहार में वो कैपेबिलिटी क्यों नहीं दिखा पाते, ये अध्ययन की बात होनी चाहिए। यहाँ पे आप एनुअल सर्वे ऑफ इंडस्ट्रीज का डाटा देखिए तो इंडस्ट्री में जितना इन्वॉल्वमेंट्स और सैलरीज मिलती है उसका 0.4%, मात्र 0.4% बिहार को मिलता है। 2011 के डेटा के अनुसार 8.58% पॉपुलेशन बिहार में रहता है। क्या शेयर मिल रहा है बिहार को? पर कैपिटा इनकम में हम लोग क्या स्थिति है आप जानते हैं, अराउंड 35% नेशनल एवरेज का बिहार का पर कैपिटा इनकम है। हमारी आजादी के बाद से गरीबी मिटाने के लिए लगातार प्रयास हो रहे हैं। कितनी राशि खर्च हुई है इसका कोई डेटा हो तो कोई बता दें, लेकिन आज भी पॉवर्टी की क्या स्थिति है देखने की चीज है। यह स्टडी की बात है। एम्प्लॉयमेंट कैसे बढ़ाएं, एंटरप्रेन्योरशिप कैसे बढ़ाएं, इस पर हमारी स्टडीज होनी चाहिए। तो एक्चुअली ग्रोथ कैसे हो, सभी लोग सम्मान के साथ अपना जीवन कैसे जिए, ह्यूमन डेवलपमेंट इंडेक्स कैसे बेहतर हो, यह स्टडी पॉइंट्स में शामिल होने चाहिए। थैंक यू।
Thanks, Kumar. I'm Avinash from Center for Environment, Energy and Climate Change. I was just curious to know, like, in the climate change and environment, you have kept it quite broad in a way. But there are few aspects of climate change, as well as environmental resource management. Are you trying to pitch in, like, when I say you, IGC trying to pitch in from the governance perspective or from the ground data gaps that, or the frameworks? Because this is, I mean, the bigger umbrella is climate change. You talk of anything, climate change comes in. But what exactly is IGC looking at in terms of addressing some of these major issues of climate change or around climate change?
Okay. I already mentioned this time in the call for proposal we only put climate change. It's not a climate change or governance, climate governance part, or is it a low carbon emission? Because when we had a conversation with the agencies who worked on climate change and issues related to environment, whatever they stated, we put down together. But we also know narrow it down only those things based on those conversation is actually you are limiting your scope, and also you are not helping the state. because your main agenda is creating an ecosystem. So if you put climate change and environment, and if researchers are able to give, because in Nalanda University, for an example, they give information about the village level microplan on climate change or something like that, and also they addressed issues related with wetland in Bihar. So, but we can't give information only on wetlands, but we want to commission studies on wetlands. So we will put climate change and environment, and then if the researchers want to study the governance part, or if the researchers want to study the ecology part of it, so then it's totally based on the researchers. We don't have the control on that, because otherwise it's a consultancy we are doing basically for them. So like that, so we will put in the call for proposal, it's only climate change, so nothing like that.
Okay. And at the same time, like, are you also looking at the training and capacity building exercises of the government? Because what we felt working at the government and different stakeholders, there's a huge capacity gap within. We cannot address, it's not that government officials cannot address, they don't understand the problem. It's about their capacity, it is beyond their capacity. So is capacity and training exercises also somewhere part of the scoping?
It's not a part of the scoping, because one of the main program component is the local capacity building.
Okay.
So under the local capacity building, so we have we will conduct several initiatives, and we will start those initiatives only after doing a TNA. So IPOD India will help us to conduct the training need assessment, and we thought, okay, whom to target to have for having a conversation. We realize unless we have a conversation with the divisional, district, and also in the state level, we are not able to get a holistic idea. So we are still discussing the methodology for the TNA, and most probably by this week we will finalize over the TNA, and from June onwards, IPOD will start the work on the TNA, and based on the TNA, we will strategize our local capacity building component. Otherwise, we don't know what is the knowledge gap. Like, everyone will say, okay, there is a gap, but we don't know what are those gaps, and is it possible if you want to launch a program on descriptive statistics, is it effective for the bureaucrats, or is it effective only for the researchers? So like that way we are still thinking. So let's see what are the training need assessment tell us, and then based on that we will figure it out.
Thank you.
The last one.
So, this is Surya Bhushan from TMI. So, I have a very brief point to make. In fact, can you split this agriculture into two components, one farm and non-farm, so that will improve your scoping exercise? Because non-farm is one of the biggest, historically it has been one of the biggest anti-poverty program across the globe, right? So, and Bihar, it could be, if you are making that as a separate scoping, that will improve your, I think,
the paper. Okay, so we will, because see, this is the main agenda of the consultation, because this is the draft scoping paper, because what we got to know and what based on the existing evidence we put down together. Like as Ashwat said, you missed out the pricing part in the agriculture research, and you also suggested the farm and non-farm, so we should address those in the paper. And Sanjita also suggested what are the things you did in the methodology, how you opt for these 224 articles. So we will keep updating this paper. And I think by first week of June we will finalize that before the call for proposal. So any other? Okay.
I'm from a network organization, so I will certainly advocate for civil society organizations. So we have a network of more than 200 organizations in Bihar. So I will request, because many of them were engaged with us in studying many of the health issues for last 30 years. So, but we also don't have that sort of capacity like you research people. So if they are also trained, if you include those civil society organizations from various districts for various issues you want to do. So if you can train, then that will also help and help their organization to identify those issues.
Yeah, so this is the part of the local capacity building exercise. So, and also the part of the data workshop. So it's look like that way. And also we are thinking, okay, for the matchmaking part. Okay, suppose there is an organization who is implementing a program and they want to evaluate their program, and there is a pool of researchers who have particular interest on that particular component on Bihar, suppose, and then we'll try to match them. If what are the discussions they have, it's separate, but we can put them together on board like that.
The second जो था, there are a lot of schemes launched by government of Bihar. So whether you have kept anything to see the impact of those schemes? Yeah. And third part, let me complete. Third part is, we are talking about various programs, various things, but whether we have assessed or searched out why things are not moving, why people are not getting those services at the grassroots level for whom the services are made. क्या ऊपर से इंस्ट्रक्शन आता है, नीचे आते आते बहुत खराब व्यवहार बन जाता है, जैसे आई एम टॉकिंग अबाउट आशा एएनएम, क्या है जाओ ना जी, ठीक है, दिस टाइप ऑफ एटीट्यूड, और ये तो उसका कुछ स्टडी करके हाउ उसका जो सॉफ्ट स्किल, उसका बिहेवियर, उसका चेंज करने से कैसे वो जाएगा, वो सर्विसेज लेने जाएगा, एक बार गया दोबारा नहीं जाता है. तो दिस टाइप ऑफ थिंग्स जो हम फेस किए तो वो आपको शेयर कर रहे हैं.
Evaluating the policy and programs is one of the main agenda. If I give you an example, like N. Vijayalakshmi of WTC, she stated she wants to evaluate the Mukhyamantri Kanya Suraksha Yojana. So I'm just giving an example because this is one of the main government scheme. And we started having conversation, okay, why don't you do a baseline before the Kanya Yojana, because they already launched. So what are the status exactly of the existing schemes? So that will help the government to have a benchmark, and that also help the government to take a look on things after 3-4 years, okay, what happened with that particular scheme. Over your last question on, I forget, what is the last question, sorry. Okay, what is the last question, I forgot. Oh, the behavior part. Okay. So, see, IGC already conducted 3 studies on, it's not on behavior, it's on leakage. So, like if I give you an example on the PDS leakage program, which is conducted by Chinmay by University of Chicago. So that also shows that there is a 30% leakage in the PDS system. But on that study also considered the attitudinal and also the behavior part. So like that way, there are possibilities in a sense, and also we commissioned studies on particular programs and policies which also take care of the attitude and the behavior aspect of that, of the beneficiary, and also at the same point of time the implementers. So that's fine. Okay, just 5 minutes. So this is before the lunch. So as mentioned earlier also, we have 3 different funding system. One is rapid response. Rapid response need to be completed within 3 to 6 months. Okay, suppose you realize government want to address that and they need an early response as soon as possible. So there is a upper cap of $15,000 on that, because now we no longer use pound for this program, to its dollar. And under the SPF, there is a small project facility which need to be completed within a year. So there is nothing called the call for proposal. This rapid response and the call for small project facility is an ongoing basis. So there is nothing you need to wait for the call for proposals. So and that is a cap of 20,000 for these small project facilities. But we can also take a look if we want to increase based on the scope of the study. We can take a look on further on those particular aspects. And the larger grant don't have any upper gap, but the larger grant only come twice in a year. So do apply, because for the larger grant we will come in first week of June, or most probably the second week of June we will come up with the call for proposals for the larger grant. And in the first time, in the first launch, we will commission 22 studies on that. So this is the things to do apply. I will send again circulate emails on that particular grant program. So if people and researchers are willing to apply, then you are welcome. Yeah. And if you have any further questions over the grant, just do send me an email, because you all have my email ID. So then I will happy to reply over the and also give you the details for the process. Thanks for coming for this consultation, because otherwise it's not possible for us to complete the whole process in the inception phase, because we are still struggling on the scoping one. And thanks for the suggestions. We will re-edit the whole paper and we will share with you soon.